believe you can reasonably claim we're one of the UK's leading support providers. But as a support provider, we know we don't get everything right. No provider is perfect. We recognise we get things wrong. Many of my colleagues, unfortunately, will be able to join me and recall occasions when an autistic person has had to leave our support. These situations are invariably complex, and as a provider, we believe it's really important we remain committed to sharing what we learn, both our successes when things go well and our failures when things don't go well. And we think that's important if we're to fulfill our ambition of supporting more autistic people to have a better life. As an organisation, we've moved away from thinking about autism as a disorder or a challenge. We view autism as a neurodiverse part of the human experience. And our response to behaviours of distress, because that's what challenging behaviour is to really try to understand why and how people experience their distress, and then what we can do to adapt our support to minimise it. Joining us today are autistic people and family members. We have politicians and a range of other policymakers. We have specialists in health, in criminal justice, and of course, numerous in-house experts who help us deliver great support. Nobody is here by chance. Each of you have been invited specifically to the summit because we believe you have a great contribution to make. The output from today will be a set of thought papers that we will submit to key bodies such as the government's Autism Strategy Executive Group and relevant all-party parliamentary groups as part of our ongoing contribution to the development of national priorities. So thank you very much for your contribution today. The BMA, the British Medical Association, tells us 8 times as many people are being diagnosed with autism now compared to 20 years ago. 1 in 100 children now have an autism diagnosis. But if you go across the Atlantic in America, that figure is 1 in 44. So I think it's reasonable we should assume our diagnosis rates will continue their upward trajectory. And one reason for that is we are gradually getting better at diagnosing women and girls. Females are counted in 2018 for 23% of diagnoses. That was up from 18% 20 years earlier. But as we get better at diagnosing, we must recognise some of the social impact. 85% of people today have had to wait more than 6 months for their diagnosis. Only 1 in 5 autistic people are in work, even though most of them want to work, and despite the national labour shortages. 6 out of every 7 children under the age of 18 admitted to an assessment and treatment unit are autistic. They don't have a learning disability. Amongst inpatients, the proportion of autism-only diagnoses has risen from 16% to 34%. If you are in an ATU with an autism diagnosis, you are far less likely to have a discharge plan in place than if you have a learning disability or a dual diagnosis. In Dimension surveys, 73% of people with autism and or a learning disability told us they've experienced hate crime. Half of autistic victims who reported this to the police said they were unhappy or very unhappy with how the police listened and acted. So nationally, it's clear to all of us we are not getting support right for autistic people. But it's not all doom and gloom. There are some reasons for optimism. Some cities, counties, local authorities have a stated aim to become autism-friendly across their area. Organisations, including government, have established strategies to become more autism-friendly. Dimensions, really proud of the fact we've supported all the major national cinema chains to offer autism-friendly screenings, and more than 500,000 visits have happened since we launched that scheme. It's a sign of our success that libraries, museums and train operators are amongst those who are approaching us for advice on how they can become autism-friendly. So it's clear the message is getting out. And we're also delighted to see the reference to the Autism-friendly badge in the National Autism Strategy. Some police forces are now undertaking autism training provided by Dimensions. And of course, we're all looking forward to the eventual rollout of the Oliver McGowan autism training for primary healthcare workers. The Law Commission's recent recommendations around the future treatment of disability hate crime reflect considerable contribution from my own colleagues, together with many others in the room today. So whilst I think there are some reasons for optimism, we can't hide from the ongoing failures to support people to get out of long-stay hospitals and units. Like many organisations, Dimensions has proposed specific policies to help tackle this issue, most recently as part of our Locked Up for Christmas campaign. To be candid, there is little to choose between various organisational and personal contributions on how to change things. And that is why, given the consistency of the messages, I think it is shameful these policy solutions aren't being grabbed with both hands. So as a sector, we know what must be done, what can be done. Our policies could make a difference. And if we're honest, there's a bit of a collective failure on our parts to persuade the government to act. And one of our hopes for today is that today our contribution may just help change that. That said, I'm going to put something out there that some people may find a bit strange for me to say, and that is I think the government's 5-year autism strategy sets more or less the right vision across each of its 6 themes. However, a good vision is one thing, but without implementation, it's just talk. I'm disappointed, so disappointed that the majority of year 1 deliverables are basically just continuing what's already been happening. So if we're to help it avoid just being talk, we must all work together to hold the government to account. Today's events include workshops on autism-friendly environments, autism policy and practice, changing how we think and speak about autism, and tackling hate, crime and abuse. In the moment, the co-chairs of each session will deliver a short introduction to the topic. You've all been asked to pre-select the workshop you'll attend. I don't think everybody's been able to do that, so don't worry if you haven't been able to do that. We won't leave you in the lobby. My colleagues will have allocated you to the workshop, which we think hopefully will best meet your experience. But first, or finally, I'm really grateful to Barbara Keeley MP for providing today's keynote speech. Barbara has been Labour MP for Worsley since 2005. She is a member of the Health and Social Care Select Committee, having been Labour's Shadow Cabinet Minister for Social Care and Mental Health from 2017 to 2020. Many of you I know will join me in thanking Barbara for being such a staunch champion for people who need support through our social care system, and in particular for her unrelenting focus on those people who are locked away in aged rooms. So for this session, we are adopting an autism-friendly approach of waving instead of clapping. So with that in mind, would you please join me in introducing Barbara to our Autism Summit? Thank you.
Thank you, Steve, for that introduction, and thank you to Dimensions for organising this summit and inviting me to speak this afternoon. It's good that so many people presenting today are experts by experience. It's important that we look to autistic people for leadership across the autism agenda and allow their voices and experiences to drive improvement. I'm mainly here, as Steve has just said, to talk about the issue of inappropriate institutional care for autistic people and people with learning disabilities, because there are some developments in Westminster to tackle that, so that's good news. But let me first talk about my connections to social care. Most recently, I was, as Steve has just said, the Shadow Cabinet Minister for Social Care and Mental Health from 2017 to 2020, and I've also twice held the role of Shadow Minister for Care. Now, I was elected as an MP in 2005, and before that, I had worked for 3 years with a national carers organisation. It's now called the Carers Trust, on a review of the Labour government's national carers strategy. I mean, I have been an MP long enough that I started off in the Labour government. For that work, I ran the biggest ever national consultation with carers, asking them how the carer strategy was affecting them and what would improve the quality of their lives as carers. The experience of listening to over 4,000 carers and what was important to them made a big impact on me. So I came into Parliament determined to act to improve the quality of life for carers. The very first debate that I led back then was on carers and social care. In Parliament, I became a champion for carers and chair of the all-party parliamentary group on carers. And I think cross-party working in Parliament can really help to improve services. And the work on carers is a very good example of that, because most of the rights that unpaid carers have came about through private members' bills, legislation brought by an individual MP rather than by the government. On social care reform, the Labour government also ran a consultation called the Big Care Debate, and 68,000 people took part in that to help shape plans for reform of social care. Now, it was just interesting looking back at that. I looked back at the white paper that was produced in 2010 on our plans, Labour's plans for a comprehensive national care service. And that would be underpinned by 6 founding principles. And I think it's interesting to look back on those and think about, is that what we want for today? Do we still want the same things? The first principle was it would be universal, supporting all adults with an eligible care or support need, but there being a framework of national entitlements. It would be free when people needed it based on need rather than the ability to pay. It would work in partnership with all different organisations and people who support individuals with care and support needs day to day. It would ensure choice and control. That's very important. Valuing all, treating everyone with dignity, respecting an individual's human rights and personal to every individual's needs, putting people in charge of their lives. It would support family carers and community life, recognising the vital contribution that families, carers and communities play in enabling people to realise their potential. And it would be accessible, easy to understand, helping people make the right choices. And there were 6 pillars that set out what the National Care Service would deliver. It would deliver prevention and wellbeing services to keep you independent. That was the first. As I said, it would be nationally consistent. So it didn't matter where you lived in the country, you should be able to have the same support. Assessment would be joined up. You wouldn't have to keep giving the same information to people over and over again. There would be information and advice about what care and support was available. There'd be personalised care and support through a personal budget, and it would be fair funding with a collective shared responsibility for paying for that care and support. And driving up the quality of care was also a key part of that. And it was important that the new National Care Services we planned, the NHS and other partners worked closely together to deliver services and ensure a care workforce was effectively supported. Now, those plans back in 2010 to build a National Care Service were comprehensive and they would have taken a number of years to implement. But Labour was not elected in 2010, so we didn't get the chance to implement them. And the coalition government of 2010 took a different route. So let's fast forward to 2019. And I think both the social care system and the debate about reform of social care look very different, because now we've had more than a decade of funding cuts and no implementation of any of the reforms proposed earlier. So in that last general election in December 2019, my party put forward policy proposals in 4 areas. First, we wanted to improve access to care. We wanted to give free personal care for older people straight away, and then a plan to extend that to working age people when we could. We wanted there to be more packages of care, just more care available. And importantly, we put in funding to move autistic people and people with learning disabilities out of those hospital inpatient units and ATUs and back in the community. We wanted to have funding to address the funding gap in social care, which is quite important and has grown, better pay and conditions for care staff and improved training and development for them so that we could improve the quality of care. Now, for me, to care and support, including providing that funding for support in the community for autistic people and people with learning disabilities who are currently in ATUs or hospital inpatient units. Steve's touched on that issue, and clearly I think it's important. I do a lot of work on this, but it's important because I think the things that have gone wrong in that area are things that are kind of wider failings in social care. Because we're now more than a decade on from that awful Panorama investigation into Winterbourne View that first exposed a really appalling treatment of people with learning disabilities and autistic people in those units like that one, in a care home like that one. And yet today, although it's 10 years since that scandal emerged, we still got 2,000 autistic people and people with learning disabilities in care homes, inappropriate inpatient units, and ATUs. Now, I began campaigning on this issue several years ago, and I heard the story of Bethany, a young autistic woman who had been moved into an inpatient unit because her local authority said it needed a break in paying for her support. So initially, she ended up in what were very bad placements entirely because of the financial situation, the funding. But the NHS ended up spending £676,000 a year to detain Bethany in seclusion in really appalling conditions. She was detained for several years and spent much of the time in a cell-like room with meals passed through a metal hatch, and even her father had to kneel to speak through the hatch when he visited. The ridiculous thing was that the money that cost the NHS was more than 3 times what the council had been paying for Bethany's support in the community. It just should not have happened. And it's appalling that 10 years after it was then the coalition government pledged to end the detention of people with learning disabilities and autistic people in those sort of units, we still have people being wrongfully detained and secluded. There was a case reported in the Sunday Times last month, the case of patient A. Patient A is a 24-year-old autistic man who's been held for 4 years in a box-like apartment at Cheadle Royal Hospital, and he's given his medication and food through a hatch. Now, there's been since that, in that 10 years, since the Winterbourne View scandal, the government has tried and set targets for itself to make changes, but we're now on the 4th time of revising of the government targets to reduce the use of inpatient beds, and every single target has been missed. And the government is not on track to miss its next target for 2024. And we can say, you know, there are lots of reasons why there's been a failure to tackle that problem. But the main thing is the government has failed to invest in high quality community services, either for crisis support or which would support people to leave hospital. And it's done too little to address the flow of people into inpatient units and ATUs from the community. And it's clear the system is not working. Local authorities have had their budgets stripped back so far that, like with the case of Bethany, they say they cannot afford the care and support that people need. And then it becomes easier for them to hand over and have people detained in NHS inpatient units. Now, the need for funding and social care reform has been overdue for many years. And despite numerous reviews and also scandals reported in the media, things still look a bit unlikely to change. The social care white paper might have offered some comfort because we were looking for government to address things like the sky-high vacancy rates for care staff, the underfunding of services, and the high levels of unmet need for support. And the white paper does have a focus on care at home, and that's welcome, but it doesn't have the funding to back it up. And there's not any mention of ending those inappropriate placements in inpatient units. Now, the government has delayed, we've waited 2 or 3 years for having this social care reform white paper, and it's delayed bringing its plans forward, partly, I think, because it could delay them. But it's lucky that's not the case with the National Autism Strategy, because under the Autism Act of 2009, the government is bound by law to review the National Autism Strategy. And the latest strategy was published last year, and it will last until 2026. I think that the strategy is going to be covered in some of the in the Autism Policy and Practice breakout group later, so I'm not going to go into too much detail about it now. But as Steve has said, that document is very much a vision document, and it's good to have a vision, but the words in themselves don't change. They don't change people's experience of care, and they don't give access to more support. And I believe that the funding that accompanies proposals to make sure autistic people get help in their communities is too small compared to what is needed. I understand just 25 million is being given to improve the 7-day specialist learning disabilities and crisis support, and that funding only lasts until 2022. Really, I think what we've got to say is that providing vision is the easy part. The delivery is where strategies succeed or fail. We will all need to keep up the pressure on the government in the coming months and years to make sure it then delivers on its strategy commitments so that by 2026, all autistic people and their families can get the vital support they need. And the issues that I talked about in ATUs and inpatient units are not insurmountable, because after a series of inappropriate placements, Bethany is now out of hospital. She just had her 21st birthday, and I know she's living in an apartment in the community with support. It's good to know that highlighting a case in Parliament and in the media can bring action from the government alongside local councils and clinical commissioning groups. What we need is a big drive against inertia and apathy that we see on this issue far too often from those who have the power to change things. The solutions have been plain as day. Many people on campaigning on these issues have said we don't need any more reviews on what is needed. We need action to make it happen. So I'm planning to start a new all-party parliamentary group on inappropriate institutional care of autistic people and people with learning disabilities. And I'm very pleased that Dimensions has agreed to act as the secretariat for the group and help keep us running. The commitments to partnership building set out in Dimensions' new strategy will be central to the work of that all-party group. We want to provide a forum for people with experience of inpatient units to share their stories so that we can maintain pressure on the government to provide support for autistic people and people with learning disabilities in their communities, not in inpatient units. And I was interested to read a couple of the success stories on Dimensions website of people who have found a better life possible for them outside of locked environments, stories of helping people to thrive. I want to listen to them and to those around them and explore how we can shape a better future with our campaign. By working in partnership and genuinely engaging with the concerns of the autistic community and people with learning disabilities, I think our all-party parliamentary group can really make a difference. I hope the summit today will offer a sense of what can be achieved. I understand that Dimensions will be publishing a set of constructive thought papers based on what comes out of today's sessions, which I look forward to reading and learning from. So thank you, and I hope everyone enjoys the rest of the day.
Right. Oh, thank you very much, Barbara and Steve, for some very inspiring thoughts and considerations as to how we launch into the Autism Summit today. I was particularly struck by 4 points that Barbara made, and that's the idea that things should be universal, things should be free, they should be in partnership, and that choice and control have to be at the centre of where we go with our thinking and where we go with our initiatives and how we move them forward. And hopefully those will be themes that will come out throughout the day. So thank you both very much indeed. I'd like to welcome everyone back in now and introduce Duncan Bell, who's the Head of Marketing and Communications, and Susan Kirkman, who's an Associate Family Consultant, to present on autism policy and practice. So over to you, Duncan and Susan.
Hello, everyone. I'm Susan, as you know. I have an autistic son who is supported by Dimensions in Sheffield. My son is very complex. He has a communication disorder. He has epilepsy and behaviours of distress, and yet he is supported exceptionally well by Dimensions. So they're getting something right with people with autism. So if I introduce myself, I'm formally a member of the National Valuing Families Forum, which sadly no longer exists. But at present, I'm a member of the local leader group, the Learning Disability Partnership Board in Sheffield, the Autism Board in Sheffield, and the Autism Strategy Executive Group. So I think I know quite a bit about what's been happening or not happening around the Autism Act. I've been closely involved in devising and the relaunch National Autism Strategy, and I'm absolutely passionate about families and also more especially people with autism having good support and the clear information. Now, you're probably all quite familiar with the legislation, with people who are here today, and the strategic environment, but just a very quick recap. The Autism Act 2009, we all thought was going to change the lives of people with autism. It was for adults on the autistic spectrum disorder. It was basically because there were far too few diagnostic services, and that was recognised. There seemed to be services for people with a learning disability and mental health issues, but not for everyone else with autism, although that isn't strictly true either. It has been already said, it's legally binding to the council. It has to be reviewed every 5 years. And that review every year to build up that picture was done through the self-assessment framework, which caused real issues. Basically because the people who were filling in the forms at the council didn't actually always agree with what people who had autism and their families actually thought. So we now have a new strategy, the National Strategy for Autistic Children, young people and adults. So that was on the back of Think Autism, which was reviewing in October 2014, which was supposed to be looking at what had improved. There actually was nothing new in Think Autism. We still had things about transition, about jobs, lack of support, lack of awareness, diagnosis taking too long, problems in the law courts, families not involved. We still wanted champions. Autism boards weren't always in place, even though they should be. Reasonable adjustments weren't there. People were still concerned about transport and health and social care. So then it was hope, fantastic, right? We still know what the problems are. We need to get on and do something about it. Also, of course, we've had COVID, which has been a bit of a problem, to say the least. And London School of Economics did a review on the effect of COVID on people with autism. And they found not only loneliness, which I think we would have anticipated, but also the fact that people with autism found that the COVID rules very hard to understand. It led to really increased mental health issues, limited access to GPs and to shopping, which caused tremendous anxiety, and people having to learn new behaviours which they found difficult, like social distancing. Many people were fearful of leaving the house in case they broke the rules. There were some with autism, of course, who thought that lockdown was absolutely amazing, including my son, who loved having not to go out, didn't have to see dogs, cats or children. He thought it was great. There is actually a guide for commissioners now across system, across social care, health and children's services. And it talks about making sure that the diagnosis is quicker, that they have low level preventative material, avoid hospital and admissions, how many people can work, encouraging people to work. Hate crime is in there as well. But again, it's nothing new. You know, we've already been said that it's no point having a vision if it doesn't actually happen. So there's now a smart delivery plan, which is funded from 2021 to 22. We're already in 2022. Not much has happened yet. And the evidence of that is there should have been an autism strategy executive group meeting just last week, which has been postponed to March because not enough has been done for us to review. So next slide, thank you, Duncan. So the strategy talks about the need to level up society and build better society for people with autism. Now here, Duncan, can we have, that's it, thank you. Here are the easy read. Last one. Here are the easy read headings from the strategy. So helping people to understand autism, it's still very hit and miss. People still think that people with autism are all geniuses. Very little known about sensory issues. Helping autistic children and young people at school, this is a new one, and hopefully will have a really good effect with people as they get older and move through to transition. Finding jobs, which always worries me because there are an awful lot of autistic people who can't work for a range of reasons. However, it's there. Making health and social care services equal for autistic people. That is really important because we hear so much about do not resuscitate rules being used against people with autism when they're in hospital. I've had a call recently with somebody whose consultant refused to operate on somebody who had cataracts because they were disabled, they were autistic. And diagnoses are often masked because people with autism can't actually get people to understand what the problem is with them. Miss the next one, and the last one, help autistic people in the justice system. I think often police think that people with autism, because they are so straightforward and so honest, think that they're actually being rude to them. So, you know, why have, you know, you've crashed a car, why have you done the car? I was just going too fast, and the policeman then thinks that they were being awkward. And the one that we're going to look at today in ours is making sure autistic people get help in their communities. So what it actually says in the Act is that it's going to achieve the targets set out in the National Health Service long-term plan. It wants to reduce the number of autistic people and people with learning disabilities being admitted into inpatient mental health services. They want to avoid people being admitted and actually make sure that the provision in the community is there. And also something very dear to my heart is to improve the suitability and availability of housing support and the social care. And it'll be better tailored so that people can have individual needs met. People would only be discharged back into the community when they're well enough to leave and that the provision is there, and we have to think about the provision for them. So by 2026, it's hoped that the transforming care targets will be met. They will be met by 2024. However, the previous targets weren't met in 2019, so they changed the rules and took it to 2024. And it's hoped then that 50% of people who are actually due to be out of hospital will be moved out. The Mental Health Act has been modernised. Autism alone is no longer to be a lawful basis for detention. And we've heard the horrific stories. We've heard one today, and we've all read of them in the paper, of people who are actually in hospital. And to be honest, I think mostly it's unhelpful to be in hospital if you're autistic. You know, if you've got sensory issues, a hospital is not going to help that. In November 2021, there were 200 under 18-year-olds detained. And 355 people had been in hospital for more than 10 years. And of the 200 under 18s, 190 were having their transfer delayed because there was a lack of community support, lack of social care, and for some lack of housing. So it's hoped to improve the provision and quality of community support, including social care, mental health, and housing. Yes, housing is the big block to prevent crisis, and that all inpatient settings have to be of high quality. They have to be therapeutic. They have to meet people's needs and be as close to home as possible. So in the first year, the government have pledged some money to try and make sure things happen. So there's going to be this 25 million to improve the capacity and capability of 7-day specialist multidisciplinary learning disability services and crisis support. So as a result, they're hoping to have a year-on-year reduction in line with the long-term plan of the National Health Service. So fewer people in ATUs. So this 15 million for key workers for children with complex needs and young people is supposed to be in place by March 2022, and 27 areas have pilots with key workers, and this will be reviewed in March, so hopefully things will improve there. Then there's the 18.35 million to prevent crises and avoidable admissions, avoidable in the sense that there's nowhere else for people to go, and to improve care for autistic people in the inpatient services. There's 21 million going to local authorities through the Communities Discharge Grant to speed up the discharges. There should be 700 people each year discharged by summer 2022 of those that are left in. And the Mental Health Act consultation has actually been completed. In addition to that, there's 3 million to go to respite and short break services. So hopefully that will mean a reduction in admission to those people with autism and a learning disability, and also without a learning disability. And linked to this is the 10% of affordable homes that are supposed to be being built. So supported housing by 2026, 10% of all housing built should be affordable. And there's also a design review by 2022 to look at houses that might be lived in by people with autism. Okay, over to Duncan.
Thanks, Susan. Apologies for the state of the slides. My keyboard and mouse are playing up. However, we'll do our best. My name's Duncan. I'm head of the external communications team at Dimensions. Difficult to follow Susan's level of experience and background. My specific interests, though, are transforming care agenda and the workforce issues that we're currently facing. Now, some of my slides will cover some of the same detail that that's already been covered, so I'll skip over bits and pieces of this. But government has gone back to building the right support, the 2015 NHS strategy, as to set its targets, and to it's talking about this in Parliament again. So let's remind ourselves what building the right support said. It said that 35 to 50% of inpatient provision will be closing nationally, with alternative care provided in the community. And back in 2015, it said in 3 years' time, we would only expect to need hospital care for 1,300 to 1,700 people. Well, as has already been said, those targets went out to 2024, and we're nowhere near them. So this Christmas alone, over 2,000 people spent Christmas locked up. 60% of those were locked up for the second consecutive year. 100 people have been locked up for more than 10 years. So we're a long, long way away from where the vision suggests that we should be getting to. But there is room for optimism here. So if we look at the overall number of people in ATUs broken down by the assessed need, we can see this dark blue line up here. This is people with a learning disability and no autism. And we can see a really significant success in the number of people with a learning disability who've been supported to leave assessment and treatment units. And really and truly, the reason why the Transforming Care agenda is being labelled a failure is because of this light blue line here. This light blue line is autistic people who do not have a learning disability. And we can see that there's been more than a 50% increase in the numbers of those people who are now locked up compared with back in 2015. The other two lines, the lime green is people who have both learning disability and autism. And this bottom line here, the red one, is people who weren't, who had no known condition. And that's gone down to essentially zero because of better recording. All right, let's see. Okay, these statistics were covered by Steve, so I shan't recap them, just to emphasize, if you have autism and you are in an ATU, your outcomes are significantly worse than if you have a learning disability. Let's look at what providers are doing. So providers should be reducing their beds. That's the idea of the Transforming Care strategy. But we see providers like Merseycare, for example, with new 40-bedded units on Merseyside. We see Signet that is building new, what they call step-down units, but I question whether they're step-down or not, because you can refer directly into them. So we see investment, not divestment. We see NHS provider collaboratives under the new ICS programme, including providers like Signet, Priory and St Andrews. We see private hospital providers developing their own residential care and creating a pipeline to discharge patients to. And all of that data was published by the Changing Behaviour Foundation, MENCAP and Learning Disability England in a document sent to government. We've also seen at the same time an awful lot of these sorts of hospitals being designated as failing by CQC. In Sheffield, for example, Firs Hill closed down for that reason, or sorry, was not allowed to accept new patients from July. So there's perhaps not sufficient investment in quality going on, and potentially as a result of this. So I quote one of my esteemed colleagues in the room today: "With appropriate resourcing, legal frameworks and genuine co-working between agencies, families and the person, people can live in the community to achieve their potential. If at all, hospital should only ever be one small step in a pathway. And for that pathway to avoid dead ends, it must include person-centered philosophy, trauma-informed planning and practice, targeting resources to prevention, and removing the opportunity to profit from institutional care." Come on, slides. Right. As a result of all of that, at this last Christmas, Dimensions produced 7 policies which we believe will unlock progress. I will literally run through them very quickly now. This is what is going to be discussed in our group session. So firstly, to fix the perverse financial disincentives to discharge patients by reducing the health dowry to 2 years from its current 5. To introduce statutory fines if any inpatient is lacking an in-date care and treatment review, including a discharge plan. For every care and treatment review, to identify local organisations which have supported people out of ATUs. To ban for-profit organisations from running ATUs. To strengthen family information networks through funding at a low level, independent advocacy groups. To invest in the specialist housing market. Housing is cited as the major barrier to discharge. Half of all delayed discharges are down to lack of housing. And of course, to fund social care in line with the local government association's assessment of need to prevent those crises from happening in the first place.
Okay, so there is a success story when people get together and start working and making sure things work. So this is something called S4A, and Space for Autism is a voluntary run charity that was set up in 2005 to support autistic people of all ages and their support networks. Over time, the membership has grown to 4,000 members, and over 250 people visit or call every week. In 2017, the hub moved into larger premises in Macclesfield Town Centre with a cafe and multiple rooms that could be used by different partner organisations, providing different interventions, activities and groups. Cheshire and Wirral Partnership first moved their children's autism diagnostic services into Space for Autism, followed by the Adult Autism Assessment and Diagnosis Service in 2018. In partnership, Space for Autism, CWP and other partners have worked to provide advice, information and early intervention to autistic people and their supporters to prevent someone requiring more specialist health or social support in the future. Space for Autism offers a support network to autistic people to minimise well-known risks associated with isolation, social anxiety and depression. And with input from CWP services, the hub can support people to navigate complex health and social care pathways and access services if required. People who suspect they or a loved one may be autistic can call or drop in and access information and support, requesting an autism assessment, and any reported barriers for assessments can be fed back to CWP services or commissions to address. The diagnostic assessments being at the hub means that autistic people and their supporters are acquainted with the hub and what it offers at the point of diagnosis, and feedback has suggested that autistic people find the environment more autism friendly and the support staff more aware of the person's sensory and social and communication differences and potential reasonable adjustments. The joint working between Space for Autism and CWP has enabled the development of close working relationships for informal support and advice. And specific sessions are offered monthly by the Adult Autism Service for staff working in the hubs and any autistic people or their supporters accessing Space for Autism. These sessions focus on a topic decided by the group and are followed by 4 one-to-one sessions for autistic people to ask clinicians about specific issues related to their autism. These sessions have continued throughout COVID-19 lockdown virtually. So it can be done with effort and with money and with people working together. It is possible to provide some good provision for people with autism. And Macclesfield isn't exactly a massive place, is it? You know, if somewhere as small as Macclesfield can do it, I'm sure other larger areas can do it as well.
Okay, well, yet again, thank you very much to Susan and Duncan for very thought-provoking stuff. Slightly alarming to see oneself quoted on screen, but there you go. And I think some themes emerging from some of the presentations coming through, not least the idea of partnership and the need for resourcing, but to be devolved properly to individuals and organisations that are truly working in partnership. And I can't resist the opportunity to note that clearly autistic people aren't the only people in the UK who found the COVID rules difficult to harder to understand and follow. But obviously I won't make too much of that. So thank you very much to all our speakers thus far. At this point now, I would like to introduce my co-host, Michelle Rebello, and we're going to talk about changing how we think and speak about autism. So, as I say, I have been introduced. I'm by profession a chartered clinical and forensic psychologist. In some ways, I could be described as a recovering clinical and forensic psychologist. I'm a parent of 2 fabulous children. I have published in the professional literature and so on, but I think a more important thing for me, and a more important thing that I want to make available to everyone here, is I'm learning more about autism every day. And I'd like to hand over just quickly to Michelle to introduce herself.
Hello everyone, thank you for coming. I'm Michelle Rebello. I'm the Involvement and Engagement Coordinator for Dimensions. I'm also an Autism Ambassador, and I run a support group called Minecraft and Meltdowns. I'm an autistic parent of 3 autistic children, and I illustrated Life Will Never Be Dull by the amazing author Deborah Branson.
Thank you. So if we can have the next slide, please, Michelle.
Oh, there's a delay.
There's a slight delay.
Yeah.
So what I wanted to do in terms of the next slide was to introduce the idea that we need to think about how we change our understanding of things. I'm sorry, that's a terrible picture of me looking out at everybody. And it's really about understanding autism and moving from understanding it as a diagnosis, given that that is seen in a very pathological way, to a condition, and the need for us and the need for professionals specifically to begin to change and move along that journey. And if I think about my own professional journey, when I started my training, we very much talked around autism, read about Kanner's original work and Lorna Wing's work, and then read about Hans Asperger's work and so on. And it took a long time, but it was a real light bulb moment to begin to understand and conceptualize of autism and autistic people as people having a condition, and that diagnosis in many ways was based on things that people couldn't do. It was based on difficulty and so on, as opposed to understanding things that could be done differently. So I think part of that is moving from a disorder where you treat it to a condition where you support, and that we depathologize the idea of challenging behavior to understand it as a behavior of distress. Next slide, please, Michelle. As such, we move away from this notion of a triad of impairments to a triad of differences. So we look at different communication, different interaction, and different imagination. And different does not mean an impairment. Next slide, please. So I think one of the other things that is really important and very close to my heart when we start to think about understanding about should we be considering diagnosis or description is this notion of diagnostic overshadowing. When we change from the idea of a diagnosis of a disorder to a description of a condition, we change from thinking about autism being the challenge to well-being to autistic people experiencing challenges to well-being. So anxiety, depression, or any other difficulties are not caused by autism, but they are things that can be experienced by autistic people. Next slide, please.
Oh, it's decided not to work now.
Technical hiccups are one of the one of the things that we all deal with. And
can you do it, Charlie?
there we are. And really, just to finish off my little contribution here is to say that we've come a long way from Hans Asperger and his description, where we have children, inverted commas, cared for by put in cages. And I think we've still got some way to go to the end point where we talk about citizens who have conditions. And then over to Michelle.
Thank you. I just want to colour Jeremy's wise words with some anecdotal evidence of my own, from my own experience, just to show how that works in the real world. So my journey is from being a parent with autistic children to realising there's a reason why they take after me, and getting a diagnosis myself. So I'll briefly outline it, because this is a journey that so many people go on, and so many parents are going on right now. So I was a quirky and misunderstood child, inappropriate, loud, daydreamer, clever, studied hard at school, really creative. If I'd been around in the Middle Ages, I probably would have been a witch living in the woods on my own, making potions and making art, and I'd have been pretty much quite odd. Several cats, though, probably. So I had depression and anxiety as a teen because I didn't fit in, I didn't understand myself, I was forever being told off. My son was diagnosed at age 6 with Asperger's and ADD, which is the not the hyperactive version of ADHD. And after that I thought, oh, what's Asperger's syndrome? I created Minecraft and meltdowns on Facebook, because that's where the only place I could go, because I was isolated at home. I worked full time, I couldn't get out to groups. So this was my way of connecting with people and going, I need some help here, what's going on? And they said, well, yeah, so do we, and let's do this together. So that was to help us support each other. After my son was diagnosed, my 13-year-old was diagnosed, and then my 3-year-old were diagnosed. And they took a year on the waiting list each. So I left my full-time job in a commercial environment, and I went to Dimensions because I wanted the stuff I was doing in my private life. I could focus on that 365 days of the year if I got a job where I could support people as well. And I also qualified as an autism ambassador. But I've had depression on and off throughout my life. So I went to the doctors and I said, I think there's probably a reason why I really understand my children. But they told me that I had to prove that either my personal life or my work was suffering because of my depression, or the way that I am, before they would put me on a list to get diagnosed. So it was a real fight, and that was in Dorset. So that was just one area of the country, and it's obviously a postcode lottery. So after many interviews, hours of interviews and many tests, I got put on a waiting list. Then I had to wait 2 years. And then after many more hours of tests over about 6 weeks, interviews, I got a diagnosis of autism for myself at the age of 42. So I'm a huge advocate, and a lot of people say, some parents say, why would I want to give my son or daughter a label? Why would I want to give my child a label? It will stop them doing things, or it will put them in a box. But from my experience of not having any idea of what I was like or where I was coming from, and then seeing my children, where I was able to fight for them and get them the support they needed and the understanding they needed, I can see the difference, and we must absolutely accept autism for what it is. But also, having said that, absolutely agreeing with it's not a disorder in a sense. But who do we hear from? So we hear from parents like myself, but parents who aren't autistic. So sorry if the picture on the left is triggering. That's quite triggering for the adult autistic community, because it's all about the autism puzzle piece, people not fitting, people not understanding, and the parents often do this whole I'm his voice thing instead of helping them have their own voice. And then on the right hand side, you've got adult autistics who can be quite volatile online and very outspoken and understandably passionate, because they understand themselves, and the best people to listen to are people who are autistic, right? And that's the best way to help your child if you're not understanding them. But these are the groups we hear from, and perhaps we should be also hearing from other people in the group, and other people and teachers, and also people who don't use words to communicate, and people who have more profound difficulties. All these slides don't want to work. There we go. And the trouble with language, and particularly that you hear from the parent group, some of the parents, and a lot of clinicians and doctors, is trouble making eye contact, difficulty listening, slow to respond to verbal requests. Language like that is really, really debilitating, because, for example, if you understand that somebody is processing a million things and they need a bit more time to hear what you said and then think about the answer and then respond, it doesn't make them slow, it makes them actually faster and very, very busy. In the same way you wouldn't think your phone was struggling if you were asking it to do a million things at once. You would understand it was doing a million things at once. So if we change our language, we talk about things and some employers are doing this now. They want people who can completely focus on a task, can be honest and trustworthy, don't need to fit in with the latest trends, often like routines, order and rules, can be very creative and have fantastic imagination. Temple Grandin says, if it weren't for autistic people, we'd still be sat in caves rubbing sticks together. And I think that's wonderful. And they may have incredible talents like eidetic memory and the sort of Rain Man stuff, but that is not everybody who's autistic. And so if you change your language, that leads to better support. So the things I advocate for and Dimensions fully embrace in terms of our working environment are things where we encourage people to help by doing things like saying what you mean, using clear language, not condescending language, say what you mean. Reduce sensory input if you can. Be a mentor, so someone understands how they work, so be a mentor for them and help them in the environment they're in. Reduce pressure, so ask closed questions, invite them to respond by email later on, rather than, just remove the cat, rather than having you stare in their eyeballs. Allow thinking time of 6 seconds to allow someone to process what you said and come up with an answer. Play to their strengths. Everyone's an individual, and be open-minded about how they get things done. It might be different to you, but it might be how they get things done, and it's just as good. And so I'm just going to hand over to Jeremy.
Thank you ever so much, Michelle. So in terms of our breakout room, we're going to invite colleagues and participants to have a discussion about, is diagnosis useful anymore? That's a contentious one, and I notice we've had quite a lot of comments already, so I'm really excited about the fact that we can have a good discussion around that. And how do we include more autistic people with learning disability in the debates? How do we open that up to people who use different ranges of communication? So I'd just like to thank my colleague Michelle Rebello again, who is an involvement and engagement coordinator, and does a fantastic job of that, and did a wonderful job of moving the cat at the side. So now I would like to hand over to Sarah and Logan, Sarah Waters and Logan Rebello, who are going to talk about autism-friendly environments. Sarah and Logan.
Hi everybody. Thank you for listening so far and for joining us today. So I am the campaigns manager at Dimensions, but I've worked on autism-friendly environments since I started here as a marketing assistant 9 years ago. My colleague Logan has been a volunteer consultant with us for Autism Friendly for over 4 years and is now a consultant within the marketing team. So what are autism-friendly environments? They are sometimes referred to as accessible or sensory-friendly environments, and are essentially venues or spaces that have some adjustments made to them to reduce sensory stimulation. Two of the key adjustments, and guests have told us some of the most important ones, are that staff are trained in autism awareness and it's a safe and judgment-free zone. Now, adjustments can differ depending on the environment and, more importantly, depending on the people attending, but some key adjustments can include the lights being on low, which means that a dark place is lighter and a bright place is more toned down. Sounds and ambient noises are reduced as much as possible. There's extra signage and instructions available before and during the person's visit, and there are quiet areas that guests can relax if their senses are getting overstimulated. Now, some venues do host autism-specific events, which means neurodiverse guests know they are with other neurodiverse people and that this is their space. But we do encourage inclusion, and the more society can adapt, the better it will be for everybody. The most important thing about autism-friendly environments is creating a space where people can just be themselves. It seems like a small ask, but judgment and fear of judgment are big factors in enjoying time away from home. So why are autism-friendly environments so important? I'm going to hand over to my colleague Logan now. He is autistic and he's going to share his experience to show why autism-friendly adjustments can make such a big difference. Logan?
Thank you, Sarah. So as an autistic person, obviously my experience is not going to be the same as everyone's experience. You know, we're all different people and we all handle things in our own different ways. Now, my experiences with cinemas and theatres, I am a massive movie nerd, so I love going to the cinemas. And usually I can go to screenings that don't have any adaptations unless it is a horror movie or an action movie, in which case I will bring my headphones to reduce the noise. Or sometimes I will Google specific bits about the plots beforehand so I know what to expect. Now, on the other hand, with theatres, I literally cannot go to a theatre showing unless it is an autism-friendly screening, because it is unnecessarily loud and the effects are unnecessarily bonkers. And for some people, that might be the case with cinemas. They might not be able to go and see a film unless it has those adaptations put in place. So by not having those adaptations there, you're singling out an entire group of people who might love movies or would love to go to the cinema, but don't have the option to go because there aren't enough screenings that accommodate them. Or simply they're not, the ones that do are just kids' films and not for their age group. Shops and shopping centres is a very sort of scary one for me. I really struggle going out on my own. Now, part of that is because of other issues with the dysphoria and feeling self-conscious about my voice, but with the autistic and sensory side, I always worry about misinterpreting what someone is saying, or not reading signals fast enough, not paying attention to the road and getting hit by a car. Essentially, there's so many elements to going outside that people don't think about and people take for granted. But having a shop open earlier where things are quieter, it is, well, first of all, it's easier to know what to expect, but it also guarantees a less stressful experience. Libraries is an interesting one because what a lot of people don't realise is sudden silence can be just as bad as sudden noise. So for me, the idea of going to a library is absolutely terrifying. And that I'd love to go to a library because I love to read, but I prefer to go to places like Waterstones where you're allowed to speak and you're allowed to sort of move around essentially without having to be conscious about what you're doing and what would make a noise. Where libraries, you're expected to be completely quiet, and if you're not completely quiet, you can sort of get looks and get frowned upon, and suddenly all the attention is drawn to you if you make the smallest of noise. So I'm really glad that libraries have been putting things in place where there's easier signage, and there are sort of, you know, creating things so you can understand what the experience is like before going.
Thank you, Logan. Now I'm just going to take you through a quick timeline and journey of autism-friendly environments with Dimensions so far. You can see how they've developed over the last 10 years and start to think about more opportunities to develop and improve what Dimensions does. So back in 2011, Odeon hosted the first ever autism-friendly screening of Mr. Popper's Penguins, and that was to over 3,000 guests. And in 2012, Cineworld came on board with a screening of Nativity 2 at over 80 cinemas. Next was View, who showed Sammy's Great Escape at over 70 cinemas, and then Showcase joined with Hotel Transylvania. In 2016, we developed autism-friendly libraries training with the Association of Senior Children's and Education Librarians, which they launched at their national conference. And then soon we hit a milestone. It was 5 years of autism-friendly screenings with over 110 films at 200 screenings and almost 300,000 visits. A couple of years later, we were thrilled to welcome Belong Arenas by Game into the Autism-friendly network and supported them to make some of their venues autism-friendly. By 2018, we wanted to create new autism-friendly cinema training so that we could provide an industry standard. Along with funding and support from the brilliant UK Cinema Association and the wonderful British Film Institute's Film Audience Network, we welcomed special guests to a screening, which we recorded as part of the training video. I believe it was Minions 2 or Despicable Me. I remember there were some Minions in there somewhere. By the end of the year, we were thrilled to have reached 400,000 visits, and the countdown to 500,000 visits was officially on. During a particularly snowy and icy new year, one of our quality consultants, Emma, was commissioned by Salford Museums and Libraries Trust to audit their venues. From her audits, we provide personalised results and recommendations, which they then went on to use. We also used this as an opportunity to develop national autism-friendly museums training and updated our libraries training package. We're getting there. After this, Picture House joined the partnership. And soon after, we were proud and humbled to receive an International Moving Image Society Award for autism-friendly screenings. I, myself, Logan and Michelle trundled to London with our friends at the UK Cinema Association and BFI Film Audience Network to accept the award at a brilliant event held in cinema. Now, for World Autism Awareness Week that year, we launched all of our new training packages for cinemas, libraries and museums. More venues took the training, and most recently we have welcomed Everyman into the partnership, and we're in the process of welcoming Light Cinemas too. Then, just before the pandemic hit, we were preparing to announce that autism-friendly screenings had reached 500,000 visits. Only that put that announcement on hold as we all went into lockdown and screenings had to stop. But our most recent research shows that since lockdown, people are actually more likely to go to autism-friendly screenings and are actually more appreciative of the screenings. Everybody seems to be pretty fed up of streaming films at home. I think it's pretty safe to say that this opinion applies to other autism-friendly environments too. So we've come a long way with autism-friendly, but we do want to do more. In our strategy, we set big aims that by 2025, Dimensions will be seen as an inclusive organisation that engages with the autism community and shares our work so we can support and promote neurodiversity. We will be promoting initiatives for autistic people by engaging with other campaigning organisations and coming together to share ideas. This includes engaging with MPs, politicians and public figures to lobby for increased representation of neurodiversity. And finally, we will be recognised for promoting increased accessibility and inclusion. Now, you might have seen in Duncan's presentation that point 1 of the government strategy supports our approach. By 2026, they want the public to have changed their behaviour towards autistic people. We all want less judgment and more acceptance. They want more organisations, businesses and public sector services to have become autism inclusive, which is a perfect opportunity for our existing and new training to make more positive changes across the country. And they also want autistic people to feel more able to take part in their communities, which the above 2 points will hopefully result in. So how can Dimensions autism-friendly environments support this? This is where you come in. In our workshop, we want to draw on your expertise, experiences and ideas to see how we can improve our existing offers, how we can track autism-friendly environments and experiences across the country to make sure we adapt, improvise and advise, what other venues and organisations should prioritise when becoming autism-friendly, the concept of an autism-friendly city, such as Greater Manchester, and can they really exist, and what we should prioritise and look at doing next. Through these discussions, I'm positive we'll identify the challenges and opportunities for autism-friendly, and we're already excited about what we can achieve with the neurodivergent community. Thank you, everybody.
Thank you very much for Sarah and Logan for that really wonderful run through autism-friendly environments and how we can adjust and adapt those. I would like now to introduce, with great pleasure, Dr. Mark Brooks, MBE, Dimensions Campaigns Advisor, and Max Green, who is an autism advocate, actor, and Dimensions Learning and Autism leader, along with Paula Gledhill, the Head of Public Affairs, to present on tackling hate crime. Over to you guys.
Hi, good afternoon, everybody, and welcome. We're going to introduce our discussion afterwards when we go into groups. So, tackling hate crime and what next for the I'm with Sam campaign. I'm happy to introduce myself. Like Jeremy said, I'm Dr. Mark Brooks, MBE, and I'm actually advocacy lead.
And hi there, everyone. I'm Max Green. So I'm an advocate, an actor, and luckily enough I've been awarded the Dimensions Learning Disability Autism Leader and Coronavirus Leader of 2020, and also won the Diana Award last year, which is the most prestigious award that a 9-year-old to a 25-year-old can win as well. I'm also autistic, have ADHD, OCD, and epilepsy. So the doctor seems to love me, basically. So that's a bit about myself.
So the I'm with Sam campaign is a national campaign tackling hate crime against people with learning disability and autism. The campaign was launched by Dimensions in October 2016, alongside 16 organisations from across learning disability and autism communities. The campaign was launched back on a survey that we did so the campaign launched after research showing that 70% or 73% of people with a learning disability and autism have been a victim of hate crime. So here's just some the official statistics around England and Wales from 2016 to 2021. And this is just around disability hate crime. And so, as you can see from year and year, the figures have gone up. Unfortunately, with learning disability and autism figures, there are none. It's very much underreported. So that's something we're going to be talking about in the group session. Thank you. Next slide. So we did a survey back in 2021 with Hate Crime Awareness Week back in October. So among all the autism people and people with learning disabilities who responded, 82% had experienced people calling them names or shouting at them in person. 34% had experienced it online as well, online hate crime. 44% had threatened to hurt or press them into doing things. So like a group of kids would say, "Oh, go and steal something from the shops." So there's been the numbers have grown in that with the thing called hate crime, which we can also have a discussion. 34% they have been victims of sexual abuse, and 16% have been threatened or pressured into doing things on the internet. Currently there are no official figures to see how many people with learning disability and autism have been committed against people with learning disability or autism, because of the way the police record cases. But our work in the National Office of Statistics have found that people with learning disability or autism are 4 times more likely to be a victim than people with other disabilities. So learning disabilities and autism are higher targeted than other disabilities. So one of the things we hope to do this year and in the oncoming years, we are hopefully getting a lobby in the way learning and disabilities and autism hate crime can be recorded. Thank you. Next slide. So what the campaign has achieved over the past 5 years. So raising awareness with people with learning disability and autism around what is a hate crime. And one of the ways we do that is easy read workshops, which we run for 2 hours, and then we as well cover stuff a couple of times over, so people with learning disabilities and understand that what is a hate crime and how they can report it. And over the last few years, back in 2019, before the lockdown, we trained over 1,000 frontline police officers in Surrey around how to support a person with a learning disability and autism, and what support they would need to report a hate crime. And also, we've also shared many of experience around hate crime, and also put them into the public arena. Thank you. Over to you, Logan. Sorry, Max.
Don't worry, I know who you meant. It's fine.
Thank you.
So I just want to talk about a little bit of my experiences growing up. So basically, I didn't have Facebook, I'd say, till I was probably in year 7. It was just when I was starting secondary school. And it's an odd thing, because if you don't have it, you're sort of bullied for not having it. And if you have it, then you run the risk of not only being bullied at school, but then taking the bullying away from school into your home life. And this is exactly what happened to me. So it started really on Facebook, turned into text messages, and even some of the times I would try and play online on Xbox, it would turn into, being invited into party chats and being shouted at and being, just verbally abused all the time. To the point where I remember being at school and I had a message from one of the people that was bullying me, basically saying if I was to come in the next day, there'd be 7 people waiting to beat me up. And it all stemmed from, because I went to a local village school, because I had a educational health and care plan. I had to go to a different secondary school, so it just meant that I had to make friends again. Basically, took me 6 years to sort of make friends, and then I had to make them again. So social media and the online aspects, basically, it sort of forces your hand to join in on the social media, and therefore, the bullying starts and continuous. And I'd say the bullying can be quite a lot worse mentally draining online, because unfortunately people say things because they are behind the screen. They, I call them keyboard warriors. They know that they can sort of get away with it. And so they don't really realise the extent of their actions. They don't understand that one thing online could turn into, a suicide case or self-harming and all this other stuff. So I just wanted to put that out there, as well as what is an online hate crime. It could be verbal abuse, it could be coercion online, it could be theft online. Because there's many people out there that will get their accounts hacked. There's many people that will have money stolen from accounts, or forced to transfer money online through basically persuasive behaviour. If you were my friend, you would do this, or if you were my friend, you would do that. and it can just really sort of carry on getting worse. So if you feel that you are being exposed to an online hate crime, there is an online hate crime hub team, which is working within the CPIC, which is the Continuous Police Improvement Command. They offer support basically for any subject matter expertise to the Met. So if I can just go on to the next slide, Paula. Thank you ever so much. So this is just some of the cyberbullying that goes on. So as I say, I was bullied quite badly online, and then it would transfer to happening in person as well. And these statistics, you know, show just the amount of cyberbullying that is happening to just neurotypical people as well. So, and this is just what we know of from, you know, surveys that have been collected and so on. And the real thing I think with technology now is how much it's evolved. You know, I work in IT and I see it day in, day out. Even some of the kids at the school that I work at, you know, some of the things that they can do, they're always one step ahead of the game. The one thing that I always try and address is things like Snapchat, Facebook, WhatsApp, and all of the above, because as technology advances, the amount that we know about it is becoming less and less and less. So when I talk about Snapchat, what a lot of parents don't know is with Snapchat, it deletes your chat within 10 seconds if you send a photo or if you send something. So, you know, whereas you would have evidence to suggest that cyberbullying was going on, Snapchat effectively deletes the evidence, and you can get the evidence back by going through the police and everything else. But a lot of the times when you need that evidence, it's too late, and the cyberbullying and everything else has already happened. So that's some of the statistics around cyberbullying. So if we just go on to the next slide as well, which can also be considered as a hate crime, is online predators. You know, when I read the statistic that there's 500,000 online predators online each day, I was stunned. But I always remember an experience I had where somebody messaged me and I had no idea who it was. And they basically said that we was friends, we met on holiday, and we played a GameCube. And the person was very, very persuasive until it was just the point where I said to my mum, I said, and I was still at year 7 at the time, but I just said to my mum, I said, Mum, did this happen? And my mum was like, no, I want you to delete this person straight away. And luckily, what my mum had set up was anything Facebook, it was attached to her email. So any chat she would get anyway, anything that was going on would go to her anyway. I'd always advise things of that to happen, because it's just as I say, how big technology's getting, it's so hard to keep your finger on the pulse all the time. Especially being autistic as well, you know, there was a lot, you try and see the good in people, you try and you don't necessarily know what other people's intentions are, you know, because you just want to see the good in everyone and you don't think anyone could be doing anything terrible. So I think it's always important that we keep companies that produce these applications accountable, because last year, especially with COVID and everything that happened there, the online usage went up, and it's the first time actually as well that data became more valuable than oil, than anything basically. And you know, we had the Facebook Cambridge Analytica scandal that was happening and everything else, and it's scary to think what they are doing with the data. But I think, yeah, it's about keeping those companies accountable, sharing that awareness and that understanding to people, to make it better. Because I always think with my with my autism and my ADHD and my OCD and my epilepsy, I was quite vulnerable to be online at that age. Luckily, I had sort of protective procedures around it to keep me safe. But there are many stories out there where it has gone terribly wrong. One story was about a child called Brett, and he was playing online with a gamer on Xbox, and this guy basically convinced Brett that he was dying, and he was going to hand him over this massive company. And then he arranged to meet up with Brett, and unfortunately Brett was basically victimized by the person and sadly passed away. So it's just about really keeping safe online, you know, making sure that we talk to each other and making these companies accountable. So that's a bit about my online stuff. I think the worst thing I could say is follow me on social media at the end of that, because that just contradicts everything. But no, that's just a bit about online safety, which we can talk about in the workshop. And yeah, so thank you for your time.
Thank you. Okay, very, very thought-provoking. Thank you very much to Mark, Max and Paula for that. I'd just like to thank all of our speakers today, and I'd like to thank everyone for contributing. I think it's made it a really fantastic and rewarding experience for everybody. Wow, how do we do final words for this? I'm delighted the autism strategy is built upon genuine ambition to do the following things: to create a coherent and sustainable strategy to provide better services to people with autism, to enhance our understanding of the issues important to the autism community, to work to reduce negative stereotypes by recognising autism as a neurodiverse part of the human experience and refocusing support to reduce behaviours of distress by reducing distress itself, to embrace neurodiversity by inclusion and understanding how and why distress is experienced and adapting our responses to minimise such distress, to deliver a comprehensive training and skills toolkit for all levels of the organisation to raise awareness of autism and increase inclusiveness, to develop individual support for autistic people, to ensure sensory needs are met by making necessary adaptations, to increase inclusiveness and genuinely engage with the autistic community, to engage with national and international campaigns, to promote increased accessibility to everyday environments by expanding the autism-friendly framework, and to stand out as an organisation that listens to and adapts to the wishes of the community. And I was thinking about this and I thought, I hope that this could be summarised by 4 points on a journey: from condescension to compassion, from pathology to people, from hate to hope, and from can't do to citizenship. And with that, I would like to thank you all very much for your engagement and joining in today. It's been very much appreciated, and I feel that I've learnt an awful lot personally. Thank you.